Well, hundreds of Canadian scientists are spending long hours in labs trying to help governments deal with the COVID-19 pandemic. And one of those researchers is Dr. Srinivas Murthy, professor of critical care at UBC. Good morning. Thanks for joining us.
Good morning. How are you?
I'm great, thank you. So you and your team received a grant from the federal government to work on a clinical trial with COVID-19 patients. Tell us more about what you're doing.
Yeah, so we're trying to figure out which drugs would be effective if you were to get COVID-19. Right now, we really have no treatments that are specific to the virus that will help make people get better. And the only way we would figure that out is through a clinical trial. And so what that means is if you are at one of our hospitals, you are randomized to one of a couple of treatments, and we see if you do better or not. And with that, with collaborators around the world, we'll be having lots of patients. And we'll be able to understand which treatments would work and hopefully understand that quickly.
So just to be clear, this is not to find a vaccine. You are trying to help people recover from this virus, correct?
That's exactly correct. So the vaccine is a whole separate group of scientists, and that's probably not going to be in clinical trials large scale anyway for a few months at the minimum. What we're hoping while we're bridging towards getting a vaccine is that we'll have some treatments hopefully available that will not necessarily cure the disease, but at least help moderately improve things while we're waiting for that vaccine to come down the pipeline. As I'm sure most of the viewers know, that vaccine is obviously hotly anticipated and really is a ticket out of this situation that we're in right now.
Absolutely. So let's talk about the medications you are using. We've been hearing about a lot of doctors testing malaria and HIV drugs as a potential treatment. Are you experimenting with those drugs as well?
That's exactly right. So we're testing that malaria drug that Donald Trump mentions quite frequently. We're testing that anti-HIV drug, and we're testing a newer drug that's called remdesivir that's been in the news for the past couple of weeks. And we're testing them against a standard of care, which is none of those drugs, but the best possible hospital care. So with that, we'll be able to learn whether any of those drugs are effective, and if they are effective, which one is most effective. And if we get new data over the course of the trial, we'll introduce a new drug into that so that we can test that drug against the other drugs.
And just to be clear, you're only testing patients with severe symptoms?
Patients who are in a hospital. And so if you're at home, there's other clinical trials that are available. But if you get to a hospital and you have severe symptoms, we'll be able to test you there.
And how do you know which medication to use on someone? Is it based on their blood type, their age?
It's random, and that's by definition. We want to make sure that we know as much as possible about which drug causes you to get better or worse. And so the only way of figuring that out is with a randomization scheme. It's like flipping a coin. And with that, we can really determine whether or not a drug is the cause of you getting better or something else.
Fascinating. So how many patients have you worked on so far, and what has the response been like?
Across Canada, it's been about 60 patients so far. Around the world in our clinical trial, it's been about 1,000 patients thus far. And we're hoping to get more and more and more. The more patients we get into a trial, the faster we'll learn things.
And how long is your trial expected to last? How close are you to finding a solution?
And so we're constantly looking at the data, and we don't have a solution yet. And as we sort of accumulate more data, we'll continue to look at it. I can't say an exact timeline, but hopefully in the next few months, we'll have some more information for Canadians.
All right, one last question for you. If someone has a mild case, what other medications would you recommend if someone becomes ill with this virus?
So right now, there are no really specific medications outside of the clinical trial to make you get better. I think it's the usual symptomatic stuff, things like Tylenol, things like lots of water and lots of rest, and obviously keeping close tabs on your symptoms and calling in if you are getting worse. But there's nothing really specific that's going to make you better. All of the news about, say, that malaria tablet that Donald Trump speaks about really has no science behind it yet.
All right. Thank you so much, Srinivas, for your insights. It was lovely talking to you.
Good morning. Have a good day.
You too. All right. It is 7.